Hey everybody, welcome to the Rare Wellness Podcast. Pressures of this modern life, society, and world often steer us towards unhealthy lifestyles where wellness is a rare treasure hidden in a maze of daily challenges. In this podcast, we illuminate uncommon pathways to health and vitality, exploring cutting-edge ideas in regenerative longevity and performance medicine, all delivered in bite-sized segments of 10 minutes or less. I'm your host, Dr. Jamie Lewis, and today we'll dive into testosterone and why it matters for both men and women. The podcast is brought to you by Center for Regenerative and Performance Medicine, located in the beautiful Pacific Northwest. Visit us online at www.c4rpm.com. Hey, before we begin, a quick disclaimer. This podcast is for educational purposes only and is not intended for medical advice. Always consult a qualified healthcare professional for any medical concerns or treatment. Today we're talking about testosterone, one of the most misunderstood hormones in medicine. Most people think testosterone is only for men, only about libido, or something you should only be taking if you're a bodybuilder. Science tells a very different story, however. Testosterone is foundational for metabolic health, musculoskeletal integrity, mood, and overall vitality in both men and women. Testosterone in men is critical for metabolic health and longevity. It plays a critical role in maintaining lean muscle mass, reducing visceral fat, supporting bone density, and regulating insulin sensitivity. It also supports mood, motivation, and cognition. However, as men age, levels naturally decline, often beginning in the mid-30s. This decline is not benign. Large population studies have consistently shown that low testosterone is associated with increased risk of metabolic syndrome, type 2 diabetes, cardiovascular disease, and all-cause mortality. In fact, one landmark study published in the Journal of Clinical Endocrinology and Metabolism demonstrated that men with low testosterone had significantly higher mortality rates compared to men with normal levels. Another major trial, the Transverse trial, published in JAMA, demonstrated that testosterone replacement therapy, when appropriately prescribed and monitored, did not increase the risk of adverse cardiovascular or prostate events in men. This is critical because for years, fear, not evidence, has driven decision-making around testosterone therapy. Testosterone in men is not about vanity, it's about preserving muscle and protecting metabolic health and maintaining function as we age. Now let's talk about women's health, because this is where testosterone is dramatically underrecognized. Women produce testosterone throughout their lifespans from their ovaries and adrenal glands, and in fact, daily testosterone production exceeds estrogen in women. Testosterone in women is essential for similar areas as in men, preserving lean muscle mass and strength, bone density, energy and motivation, mood stability, libido and sexual function, and cognitive clarity. Low testosterone in women have been associated with fatigue, depressed mood, loss of sexual desire, reduced exercise tolerance, and decreased quality of life. Multiple randomized controlled studies and consensus statements, including the global consensus position statement on the use of testosterone therapy in women, published by the Journal of Clinical Endocrinology and Metabolism, have concluded that physiologic testosterone therapy is effective and safe for women with hypoactive sexual desire disorder or low androgen levels when appropriately prescribed. Importantly, these studies show no evidence of virilization or serious adverse events when testosterone is dosed to physiological female ranges. This is not about pushing hormones beyond normal. This is about restoring what the body no longer produces adequately. Let's talk about why normal labs can be misleading. One of the biggest mistakes in hormonal evaluation is relying solely on total testosterone and broad laboratory ranges. Here's why this matters. Testosterone in the bloodstream is largely bound by proteins, especially sex hormone binding globulin. Only free testosterone is biologically active. Studies published in endocrine reviews have shown that free testosterone correlates more closely with the symptoms and clinical outcome than total testosterone alone. This is why someone can be told their testosterone is normal and yet still feel exhausted, weak, foggy, and unmotivated. At a clinical level, if testosterone isn't biologically available, it's not doing its job. Testosterone therapy has been controversial not because of strong evidence against it, but because of misinterpretation of early observational studies. Modern, well-designed trials now show no increased risk of prostate cancer with physiological replacement, no increased risk of cardiovascular events when patients are properly selected, and improvements in bone density, muscle mass, insulin sensitivity, and quality of life. Professional societies now emphasize monitoring, dosing, and patient selection, not avoidance. When testosterone therapy is treated as medicine, not as enhancement, outcomes improve dramatically. So who could consider getting a hormone evaluation? Well, if you're experiencing persistent fatigue, difficulty building muscle or losing fat, reduced exercise recovery, mood changes or brain fog or low libido, these are not things you should simply push through. They may represent hormonal insufficiency, and the only way to know is to measure it properly. At the Center for Regenerative and Performance Medicine, we take a physiology-first approach. We evaluate symptoms, hormone levels, metabolic health, muscle, and body composition. Because hormones don't exist in isolation. They're part of a larger system that determines how you feel, move, and age. Hey, thanks for joining me today on the Rare Wellness Podcast. If you found value in today's episode or learned something new, please subscribe, leave a review, or share this podcast with a friend. Your support helps us to continue to provide free content to empower you on your journey to better health. This is Dr. Jamie Lewis reminding that your body holds incredible potential to heal, thrive, and perform. Sometimes it just needs the right tools to unlock its full potential. We'll see you next time.